Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide information, education, commentary on all sorts of sports and exercise injuries for athletes and active people, probably much like you, so that you can stay healthy and perform your best. Now, as an orthopedic surgeon, one of the questions I get from patients when I'm talking to them before surgery, trying to say, hey, this is the injury, these are the options, non-surgical treatment and surgical treatment, and why I think surgery is a good idea, rightly so, one of the questions I get is, how likely is this surgery to work? And it's an absolutely great question to ask. You should ask that question if you're ever going to have a bone or joint surgery. But it's a really important decision and discussion to have when you're talking about arguably one of the most common injuries in all of orthopedic surgery, and that's a meniscus tear of the knee. So I want to discuss one of the aspects of success and outcomes and healing of meniscus surgery in today's Ask Dr. Geier video. Tim in Alberta asks, I had meniscus repair surgery done January 27th of this year. The knee will not extend, it becomes locked at a certain point. They put me under and tried to straighten it, but it failed. I'm just wondering if this guy botched my meniscus repair. I still can't extend the knee fully or bend it back. Okay, that's a terrific question, and honestly, I can't really say if the surgeon did the surgery right or not, but let me put another perspective on it. But before we do that, let's talk about, real briefly, I talk about meniscus injuries a lot, but let's just quickly recap. The meniscus is the C-shaped shock absorber. You have one on either side of each knee, one on the inside or the medial side, the side closest to the midline of the body, and one on the outside, the side away from the midline of the body. And you can tear that with twisting injuries or deep squatting injuries. Some older people don't even remember doing anything and they got a meniscus tear. But the majority of meniscus tears, especially as you get older, in your 30s, 40s, 50s, 60s, a huge percentage of those are treated by trimming out the part of the meniscus that's torn. It's called a partial meniscectomy because it's the nature of the tear. It's the location of the tear, not being an area where there's much blood supply to the meniscus, or it's kind of a beaten up appearance. It's not a straight line tear. So an attempted repair wouldn't heal in those type of meniscus tears, so we trim out the part of the meniscus that's torn. But having said that, there are a small percentage of tears that you can actually sew back together, what we call a meniscus repair. You typically see it in your high school and college age athletes, but you can see it in adults in their 20s and 30s as well. Now, there's a lot of those meniscus tears that are repairable that occur when somebody tears their ACL. So you go to do the ACL reconstruction, you would go in and put stitches in the meniscus to sew it back together. And that has a good success rate when you do a meniscus repair surgery at the time of an ACL reconstruction. We think that drilling those tunnels in the bone for ACL reconstruction, if you want to see an ACL reconstruction, I have a video, it's on my YouTube channel, a couple years ago where I show you an ACL reconstruction. But what you'll see in that video is the surgeon, in that case me, I'm drilling tunnels in the bones to pass the graft. Well, when you drill tunnels in those bones, holes essentially, you have bleeding from the bone, and that gets all throughout the knee, but it gets to the area of the meniscus repair and helps it heal. Now, one of the challenges though, if you have a meniscus tear that's repairable, but it's what we call an isolated meniscal tear, it's not in the setting of an ACL injury or some other injury, and you go in to do the surgery and it's just for the meniscus, those we know have higher failure rates. In the past, we thought that was up to 30-40% of meniscus repairs, even the ones done really well with lots of stitches and done right, they still failed. More recent studies have shown that number is probably somewhere closer to 10 to 20%, but that's still a pretty decent failure rate. Has nothing to do with the surgery or the quality of the surgeon. It probably has very little to do with the patient, even though I would imagine compliance, following postoperative instructions and restrictions is important, but it's a lot based on the inherent nature of why meniscus tears need surgery in the first place. They don't have good blood supply, and so they're prone to not healing. The ones that are repairable typically are in sort of the back of the knee where there is good blood supply or relatively good blood supply, but that risk is still there that, basically the blood supply isn't enough to get it to heal. Fortunately, again, that if you did, took away the 10 to 20% that have failure rates, meaning they don't heal and then they're still blocking motion or they still cause pain and you have to go in and do a second surgery, that 10 to 20% that don't heal or fail, that still means that 80 to 90% do well. And I would argue, if it's the type, if the surgeon gets in there with the scope and sees that it's the type that's repairable, you do want to try to repair it if at all possible, because if it does heal, then you preserve that entire meniscus shock absorber to basically protect the knee over the coming decades and hopefully slow or minimize or prevent the onset of arthritis down the road. Okay, have you had a meniscus tear, and did you actually have the repair where the surgeon went back in and sewed it back together with stitches and with anchors? I'd love to hear your experience. How did the surgery go? How did the recovery go? How long did it take to heal and for you to get back to activities? So below this video, I'd really appreciate it if you'd share your comments. Not only would I like to read it, but I think it would help other people going through these problems with meniscus tears, deciding what to do about surgery, and trying to see how they're doing after surgery. So definitely share your comments below this video. And if you know somebody that has a meniscus tear going through something like this right now, or maybe they just went through a similar problem, please share this video with him or with her, and hopefully this information can help them make a decision about what they would like to do, help them understand their recovery from this surgery. Now, if you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, I record a couple of these videos every single week. So subscribe to my video channel. I think these videos are really helpful and I'd love to deliver these directly to you. And last, I record a number of videos. I write a number of articles. I record audio content, completely free that I share with my email list. And they're on all sorts of ways to stay healthy and perform your best in whatever your sport or exercise. So go to my website, drdavidgeier.com. Enter your name and your email list, and I'll get those resources to you for free. And I'd love to interact with you that way as well. Thank you so much. Thank you so much for watching. I hope this was helpful. Remember to share this video if you know somebody with a meniscus tear going through the surgery or the recovery. Thank you so much for watching. Remember to subscribe to my channel, and thank you so much. I look forward to seeing you right here next time.